All right, now Victorians will pay a new tax from next year to help fund a major overhaul of the state's catastrophically failing mental health system. The ongoing levy is one of 9 recommendations made by a Royal Commission into the sector.
Chronically underfunded, woefully unprepared.
It is the weak point, the failure point.
A scathing assessment and...
Everything we have heard has confirmed that poor mental health is pressing yet largely ignored health crisis in Victoria.
The Royal Commission's 680-page interim report found 105,000 Victorians are missing out on specialist care. The crisis overall costing the state $14.2 billion annually. The government promised to implement all 9 recommendations.
It will not be easy, it will not be quick. But its time has come. We have got to do this.
The recommendations include 170 new acute mental health beds, boosting the number of mental health professionals by creating more positions and funding education, creating an Aboriginal social and emotional wellbeing centre, boosting outreach and clinical support, and a new revenue source.
There will be a levy, there will be a charge, it will be ongoing.
Just how much this tax will cost is unclear. What is known as a major redesign of Victoria's mental health system won't come cheap. The Premier estimating the levy will eventually raise between $500 million and $1 billion annually.
But the cost of inaction is far, far greater.
It's welcome news for the 1 in 5 Victorians who suffer mental health challenges every year. They hope the levy is viewed as an investment in the future.
I used to carry a bullet inside my pocket, so and I was always going to use it on myself. So I look back and think, well, you know, I've been struggling with mental health for 25 years.
But not everyone is convinced. The state opposition proving reluctant.
Do we need to do that through a tax, or should we look at other mechanisms to fund mental health appropriately in this state?
The Royal Commission's final report and further recommendations will be released in October next year. Andrea Crothers, Sky News, Melbourne.
All right, let's go to the front of the Herald Sun, where that story is also on the front page. Mental health overhaul. A new tax raising up to $1 billion a year is the centrepiece of an unprecedented state government plan to fix the catastrophic failures of Victoria's mental health system. Look, I think the whole issue around mental health, Dan Petrie, is not just a Victorian problem. I mean, this issue sort of extends throughout the country. I think it's an issue that COAG should be having a look at, but at least Victoria is leading the way with this particular story.
Well, they're certainly leading the way. I mean, in terms of a levy, sometimes I'm dubious when levies or taxes are introduced as a way of addressing an immediate problem, but the bottom line and the overriding line here is that mental health does need a national approach. I think you're quite right, Gleesa, that this should be done through COAG. So it is pleasing to see the government there really focused on trying to find some solutions within that system. But again, in that package, devastating to hear that people are constantly on the edge.
And Alexis, I spoke to some senior police officers not that long ago for a column piece in the Sundays, and they said at the heart of just about every domestic violence or escalation in violence situation at home is either a mental health issue or an illicit drugs or alcohol issue, or invariably both.
Yeah, that's exactly right. I mean, look, on the one hand, no one wants to hear that they're going to be taxed more. Of course, it's not going to be popular amongst the general public. But on the other hand, we know that mental health is at crisis point in this country. And obviously, we've heard that it's at catastrophic levels in Victoria specifically. It's chronically underfunded. We need to get the money from somewhere. So it's easy for me to say I'm not a Victorian, but I can't see any problem with introducing this levy. And I know that our readers at news.com.au, whenever we hear any stories about domestic violence, about self-harm, the comments from our readers are always crying out for more funding for mental health. And look, I think this is a solution that we're going to have to look into more and more.